The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Okay. About 70% of individuals over age 65 will require at least some type of long-term care services during their lifetime. Much has changed in long-term care over the last 20 years. Stay tuned to find out more about this increasingly necessary form of health care tonight on Health Connections. In 2003, there were over 4,000 continuing care retirement facilities in the United States. And at the same time, there were over 330 people turning 60 every hour, according to the United States Census. We're here to find out what effects these and other trends will have on the long-term care industry. With us tonight from St. John's Lutheran Home in Albert Lea, Minnesota, is Scott Spates. Scott, thank you for joining us tonight.
You're welcome.
So, Scott, tell us, what is your role with St. John's?
Okay, I'm the CEO and administrator at St. John's Lutheran Home in Albert Lea, and I've been there for about 5 years now.
Okay.
Should I say a little bit about our campus?
Sure, please.
Real quickly, because I think it mirrors what's going on throughout the state of Minnesota and throughout the country. So on our campus, we have a skilled nursing home, and then within the skilled nursing home, we've carved out some specialty services. So we have a 20-bed Alzheimer's unit for people that have memory loss. And then we've also carved out 20 beds of the nursing home just for those short-term stay people. And those are the people that we know when they come into St. John's that at some point after 30 days, 60 days, 90 days, they'll be returning home. And then two other pieces that we have on our campus is we have senior housing, and it's technically called housing with services, and that's for people seniors that can live independently. And then we have also on our campus owner-occupied condominiums, which we manage, but the people that live in those 19 units own those units and make their own decisions about what they're going to do with their units. So
a pretty diverse layout. Huh?
It's a nice campus with a lot of options for people.
Is that typical of long-term care facilities then?
We're seeing more and more, especially over the last probably 12 to 15 years, where nursing homes realized that they needed to get into the housing side of senior care, so they put up housing units, and some of those are assisted living and some of those are housing with services.
So with that kind of diversity in housing and services in that sense, has your primary mission been evolving and changing over the last few years?
You know, our primary mission, St. John's, was established 48 years ago, and our mission at St. John's has always been to provide care to seniors. I think what's evolved is how we provide services and care to seniors. I mean, at one point, our campus just had a nursing home, and then added a housing, and then added another housing. And I think throughout the country and throughout the state of Minnesota, that same pattern's been repeated, where a lot of organizations started out just as nursing homes and then realized that there was a need for housing for people that could live independently, but didn't need all the services that were offered in the nursing home.
Okay. So other than housing, nursing facilities have had a ton of change over the years, very much like the rest of healthcare, where it's been continuing evolving.
Right.
How long have you been in this field?
Well, I started in this line of work in 1988, so 20-some years now. So
what has changed in the 20 years that you've been involved?
There's really been some huge, significant changes, and they're happening throughout Minnesota and throughout all of the United States. I'll give a couple examples. One is 20 years ago when I first got into this line of work, it was pretty common for nursing homes to use physical restraints. And the intention of using those physical restraints was to protect the residents from harm. I mean, our intention was good. We didn't want residents to fall out of their wheelchair. We didn't want residents to fall out of bed and break an arm or break a leg. And we found that we were actually doing more harm because the residents' quality of life was significantly diminished when we restrained them to their chair or to their bed. So 20 years later, I mean, to the present now, we don't use restraints. They're just not acceptable in the nursing home setting. And I think the quality of life for the residents is much better because of that.
Sure.
Another significant change that's happened, especially I think over the last 10 years, is we're seeing more and more people come into the nursing home, receive nutritional meals, get the nursing care that they need, receive the therapies that they need, and then go back home or back to their apartment. Whereas 20 years ago and 30 and 40 years ago, when you went into the nursing home, that was the last place you were going to live. And I was just reviewing a report about a week ago on this, and I believe the report was from the Minnesota Department of Health, and they kind of track discharges throughout the state of Minnesota, and the statistics were from 2007, I believe, and 48% of all discharges from all the nursing homes in Minnesota, 48% of those were people discharging back to their home or apartment. And people used to think, I mean, there's still that perception that when you discharge because you die, and that's how you get out of the nursing home. It's just simply not true anymore. It's one of the major changes.
You know, you segue into a perfect question, really, is that the perception that people have of nursing homes has traditionally been very negative. And
yes.
over however many decades that nursing homes have really been serving people, that the restraints has been one aspect where people think that they're going to be treated like animals instead of humans, and and how is that perception evolving and changing, and what as the CEO of a facility are you doing to help change that perception for the public?
And that perception is still out there. I mean, you hear that from people that come in. One of the changes, and I think this gets into the perception issue, is our schedules that we ran a nursing home on were very structured and very rigid. And they weren't determined by the resident. So for example, if breakfast was at 8 a.m., it was at 8 a.m. for all the residents. Even that resident that before they came into the nursing home, they might have been in the habit of sleeping until 10 a.m. And the way we used to do things was, well, it's too bad everybody is up by 8 a.m. and in the dining room by that time. And I think that's one of the perceptions, is that we're real rigid, that people have to, they have to adjust to the nursing home schedule and practices, and they really don't have any say on what happens on a day-to-day basis. And nursing homes throughout the country actually have made that change where they're listening to the residents and letting the residents make those decisions about when they get up, when they go to bed, when they, what days of the week they like to have their shower or bath, those type of things. The other perception I think that tends to be, has real negative connotations, is that when a person goes into the nursing home, all they do is sit around and they play bingo, and they, what's the other B? There's two B's, bingo and Bible study, and that's all they do. And I think what we're finding more and more throughout Minnesota, at least, and probably throughout the country, is we're looking for more meaningful ways for people to spend their time while they're at the nursing home. So for example, at St. John's, and I think this is happening throughout Minnesota, we have trips where so if one of our residents was a member of the Elks Club, all his life or her life, or a member of the Moose Club. We'll do trips to that club, and they'll go there to have a meal or to sit down and have a drink or whatever. We have a full gardening program, for example. So residents that all their life they had a garden, they don't have to stop gardening just because they came to the nursing home. We have this gardening program. They can go out and plant tomatoes, plant corn, have flowers, and those type of things. So nursing homes are realizing that we need to have meaningful activities, meaningful events for the residents.
How common is that from St. John's to, say, other facilities?
Well, I think it's getting more common where homes are trying to look for, not things just to keep residents busy, but things that really have meaning to the residents. We had a resident, she's since passed away, but during Hurricane Katrina, she wanted to do a fundraiser for the people that were affected by the hurricane. So she actually made these little apples on her own time out of paper product and sold those for 50 cents and then took that money and donated it to the Salvation Army. And the staff got involved in that. The other residents were involved by purchasing these apples. And that was a meaningful, very meaningful thing for her to do, and she was helping people outside of the nursing home.
No. So what it really sounds like is you're going through a complete culture shift. So instead of what it used to be of the patient or the resident in this case adopting to the facility, the facility is now adopting to the patient.
And that's exactly how we're trying to do things, exactly. Okay. And it is more difficult to do it that way. But it's more rewarding for us that work in the nursing home because we know we're providing a better lifestyle for that resident. It's easier to have everything kind of scheduled out, and you do, as a nursing home worker, you come into work and you know that you have to do A, B, C. You have to get these tasks done in this order. That's pretty easy to do. But it's more difficult and more rewarding to ask the resident, what do you want? And then to try to accommodate that resident's wishes and needs.
So as you see this healthcare reform coming through, and you're looking at a complete culture change in what you're doing, this huge evolution, and now healthcare is going to make a whole nother shift on a national basis. Are there things in the healthcare reform that really speak to nursing facilities? Right.
I think the main the main piece of the healthcare reform bill, the National Healthcare Reform Bill, it has to do with, and I'm trying to think of what the terminology is for it. It is, I can't think of it right now. But there's an element in the healthcare bill that addresses funding for long-term care.
Sure.
And it's a voluntary program. It is a self-paying program. So I, for example, could decide I wanted to get into this program. I would pay for the program, and it would be a public program that anyone in the country could be part of. And the idea would be that our future needs for long-term care, we would start funding them at an earlier age, as opposed to not planning at all, or trying to do it on our own.
So do you still have the same funding constraints that, say, the rest of the healthcare world has, or are you really working in a different model?
No, nursing homes are very underfunded, and I know they're expensive. I mean, they're definitely costly. So private pay person, the average private pay person probably spends, if they're there a year, it's probably $60,000 a year. But it's very expensive to actually run the nursing homes, too. 70% of all our costs are in labor.
Sure.
So if you're looking at trying to reduce the cost of nursing home, what you're looking at is actually, the main thing you're going to look at is your labor costs. And there's an ongoing tension between trying to maintain the costs so they don't get too expensive, but but also trying to make sure that we have quality care. And you can't do quality care on a shoestring staffing level. You know, you need the people there to take care of the residents and meet the needs of the people. So there's that constant tension between those two pieces.
And I suppose that staffing model is very close to what a hospital would be, is 24/7 coverage, or
right. And yes, yeah. I think hospitals tend to be, you know, one nurse to, and I probably shouldn't say I'm guessing, but I think their ratios are much better than ours.
Okay.
You know, yeah, their ratios are better than the nursing home setting.
Do you also have a different types of nurses where you tend to have more LPNs versus RNs, or is that similar to what you'd see in a hospital?
Well, we have RNs on our staff, of course. We have LPNs. We have TMAs, nurse aides, and I don't think the hospital and the nursing home staffings. I think the way we staff is very different.
Okay.
So I don't think there's a comparison between the nursing home side and the hospital side.
Okay. Okay.
I will comment, though. I mean, one of the things that we struggle with as an industry is maintaining and keeping good staff.
Sure.
And if we have good staff and people that have heart, they love their work, they like working with residents, the residents get good care when we have good staff. And one of the things that we wrestle with, because our funding tends to be so limited, is that our staff makes significantly less than in a hospital setting. So an RN, for example, and the last numbers I saw were probably 4 or 5 years ago, but an RN at that time, I think, in the nursing home setting was making $4 an hour less than an RN in a hospital setting. So that makes it difficult for these nurses to choose to go into the nursing home setting.
Do you think that also predisposes certain issues where you might not be able to get the people with the best credentials, or does it create those type of issues for you?
I don't think so. I think the people that go into that choose the nursing home setting, they choose it because in our setting we tend to have longer relationships with the people that we're dealing with.
Sure.
And I think that's the main draw in terms of, should I work in a nursing home or a hospital setting, or a nursing home or a clinic? I mean, one of the benefits of working in the nursing home setting is you may be working with someone for 30 days or 60 days, and you really get to know that person. Or you may be working with them for a year or two, and you have all this time to establish that connection with that person. Whereas if you work in the clinic, the patient comes in and the visit's for 15 minutes or half an hour, and you might not see that person again for 6 months or however long. Or the hospital, you're in the hospital for 2 days or 5 days, so you don't have the time to make that real intimate connection with the person.
Well, the relationship factor is really, really key for patients and residents.
Yes.
When it goes well, you get a very good rapport, and you get patients and residents that seem to really gel together.
Yes.
What happens when it goes wrong? Does the patient, what kind of recourses do they have?
Well, to be honest, it doesn't go wrong often.
Sure.
I mean, one of the things that we do at St. John's, and I think other nursing homes do it, is we have dedicated staff in each wing. And one of the benefits of having a dedicated staff is that that resident can get to know that staff person, and the staff person can get to know the resident, and we get to know the families, and we get to know the residents' likes and dislikes, and when they want to get up in the morning, when they go to bed. So it really doesn't happen too often that there's actually like a clash between the residents and the staff.
Sure.
Because I think over time there is that relationship that develops.
You know, and I think that's great for people who either have relatives that are about to go into this situation, or maybe themselves. I think that's comforting for people to hear that because if you watch through the media, watch
Yes.
television, it's always the evil, overbearing male nurse who
Right.
forces everybody into elderly labor,
Right.
and and those type of things. But I think it's great to hear that,
Yes.
saying that those things are very, very rare, and that you
Yes,
really
yeah.
don't have that type of
Right.
issue. So speaking to those people who have either relatives that are about to go into a nursing facility or maybe themselves, what should these people really be looking at for picking the right facility for themselves or the loved ones?
Okay. I think there's a number of things that people can look at. One is, I think, just listening to other people that have been in that nursing home or have had family in that nursing home, and get, just sitting down with them, and what was it like for you? Did you think that your family member got good care? Did you get good care? So I think that's a excellent way to get information. It is a good idea for people to visit the nursing home if they have a chance before they're going to either themselves have to go into it or admit a loved one into the nursing home. And when you go in for a visit of a nursing home, what you're looking for are things like, do the residents look happy? Are they clean? Are they just sitting around and with nothing to do, and staff is not interacting with them? That would be a sign. That would be a bad sign. Are there odors? Are there bad odors in the building? Is the building kept up? I mean, those are some of the things that you can kind of do beforehand before you end up either admitting your loved one or yourself into a nursing home. One thing I'll mention here, because I do think it's important, is often seniors schedule surgeries in advance. So they may know a month or two in advance that they're going to have knee surgery.
Sure.
And they also know that it's probably going to be recommended that they go into a nursing home for 30 or 60 days, get the nutritional meals they need, get the therapies they need, and then after that 30 or 60 days, then go back home. And I really think it benefits people to actually check out the nursing home beforehand and go in and talk to the social workers, talk to the administrator, ask for a tour, and just try to get a sense of whether or not it's a facility that you think you'd get good care in.
So how about things like you were mentioning the activities that everyone does?
Sure.
Should those type of things be easy to get to or easy to obtain from facilities that you might be visiting to see if they're appropriate for you?
Right. And activities, every nursing home has a schedule, a monthly schedule. So that would be something that you could actually ask when you went into the nursing home. Could I get a copy of your monthly activity schedule? You could ask things like, do you go on outings? I mean, especially if you're admitting a loved one and you know that they're going to have to stay there. I mean, those are the types of things you want to know. Are they going to have things to do today? Do you do outings? Do you ever go out fishing? I mean, during the summer months, we have some of our residents go out fishing. Do you ever go to basketball games or wrestling matches? And we try to do outings like that because that's what people did before they came into the nursing home.
How about video games?
We actually have 3 Wiis, and some of the residents really love video games, and some have a hard time.
Sure.
Bowling's hard for some of them just because of the arm motion.
Yep.
But yeah, we have 3 Wii games.
Great. Yeah. So that actually kind of speaks to, again, the changing of the cultures. As we've gone from 20 years ago, none of this type of technology like the Wii exists.
Right.
What do you see in the future as baby boomers are getting to the point, turning 65 this year, next year, and beyond? What do you think they're looking at 20 years out?
A number of things. For one, just a comment. I think the baby boomers are more vocal, more demand, or more. I shouldn't say demanding, but maybe that is the right word. But they're vocal about what they want.
Sure. More aware, maybe.
Maybe more aware, more willing to speak out and say, well, this is this is something that we're interested in. A number of things that I think the baby boomers are going to want. For one, most of the nursing homes that were built, that exist now, were built 40 or 50 years ago. And the rooms were built for double occupancy.
Sure.
So 2 people in one small room. And I think we're going to see more and more homes going to private rooms for people. So that if you have to go into the nursing home, because people don't really, it's not like, oh yeah, I get to go to the nursing home. It's not something you get all excited about. But if you do need to go there, I think the boomers are going to say, at least give me some privacy. So, I'm not concerned about how big the room is, but I want to be able to shut the door and watch TV at 12 midnight. Or I want to be able to sleep until 10 a.m. and then get hard-boiled eggs and bacon. So I think that's one of the things the boomers are going to want. We know they're going to want different amenities like access to computers. And nursing homes are starting to upgrade their buildings with the technology so that people can have computers in their rooms. What else are they going to want? The other change,
possibly
I think,
home care instead of facility care.
Right, and I think that is another trend that we'll see. People may want to live in their apartment longer, and they'll want the services brought to their apartment, as opposed to going into the nursing home. And I think 15 or 20 years down the road, the nursing homes there's going to be more and more people that go to nursing homes just for that short-term stay. And right now, we average probably around 15, maybe 20 people out of our 170 that are in the building at any one time that are going to go back home. And I think that will probably double in about 10 years, might even triple. So I think the nursing homes will be used more and more for those short-term stays. And some of the things that are happening in the nursing home now will happen over in the assisted living or the senior apartments.
Well, I think you've given us a lot to think about and try to put away some of the myths about nursing homes and facilities, and really show us that maybe they aren't as scary as some other people really think. I'd say thank you, Scott, for coming in. I think everyone out there in America is actually knows someone or has a family member that's been in a nursing facility. And I think it's a great thing to really help get some knowledge out there about it and give people an idea of what's going on out there. So I want to thank you again for coming on the show tonight. Yeah, thanks.
You're welcome.
Well, thank you again for watching Health Connections. We hope to see you again next week. And this has been Sean Riley with Health Connections.